The Scale Podcast. I'm your host, Dr. Spencer Nadolsky, and I got one of our favorite awesome dietitians, RDs, Cristina Flores. She is a bariatric, post-bariatric, pre-bariatric RD specialist, and I wanted to get her on to talk about kind of the nutrition around bariatric surgery and how that kind of goes along with our plan, because we have about, I'd say around 10% of our patients come in post-bariatric surgery, whether that's a Roux-en-Y gastric bypass or other types of bypasses, or a vertical sleeve gastrectomy. And I think we probably have some lap bands with us, but not so many anymore. So welcome, Cristina.
Yeah, thanks for having me.
Yeah, so tell us a little bit about your background in the bariatric clinic and all that stuff, and how you went through your training.
Yeah, so I previously worked in a bariatric clinic at a hospital. It was a hospital-based program. And I saw patients before surgery, while they're having their surgery, the day after surgery. I went and saw them in the hospital bed, and then I followed up with them long-term after surgery. So lots of different preparations to get ready for surgery, kind of going through the expectations and what to expect, what's going to change, what might not change. And then coaching them through that after surgery as well. And it was a great experience, and I'm so excited to work with all of the sequence members who have had surgery here as well.
Very cool. Do we preferentially give you the patients when they have clicked on their intake that they had surgery?
Sometimes, not always.
Sometimes.
But if they ask for someone who's had has the experience in bariatric surgery, it's always me.
Perfect. All right, let's go over like just some of the nutrition things that were kind of like the protocol for after the various surgeries and whether they differed based on the surgery. So let's start with like probably the most common one is like a vertical sleeve gastrectomy, or VSG as some people call it. What were the protocols after surgery for them, nutrition wise?
So for everyone, vitamins for life. With the sleeve, that's the multivitamin, the calcium with vitamin D in it, and then the B12 as well. And then, of course, that's first and foremost, make sure you're taking your vitamins for life. Second, protein. Protein's super important, pretty much for all weight loss, but especially when you're not able to get a whole lot in. Having at least 60 grams of protein after surgery for women and 80 grams for men if possible. And that's just a starting point. With the protein supplements and all that you have to drink after surgery, and then once your stomach gets used to the surgery, tailoring that to each person and finding the right protein goal and proportion. Carbs are drastically reduced immediately post-op, just because there's not a whole lot of room for them when there's the protein, and then trying to get those vegetables and fruits in. But then working through that to where we can work those carbs in later is kind of the main thing that I focus on with the sleeves.
Was there a volume amount? Like, did you show them certain volumes, like, hey, don't go past this type of volume, and certain types of lean proteins that you advised on?
Yeah, so when it comes to protein, a good goal is 2 to 4 ounces, and that will vary person to person, but just getting what you can and listening to your body is important, because one person might take 2 bites and be full, and the next person can finish 3 ounces of chicken breast. So coaching them through that and ways to get that protein in. So it might be, having 1 egg with breakfast for some people, or 2 eggs for other people, but how are they going to make that up later in the day? It might be a protein shake in between. And then, of course, lean proteins like chicken breast, turkey, lean beef is totally fine, and coaching them through that as well.
How do you coach them on the sizes? You make them weigh it, or did you show them like portion sizes, or how did you do it?
Yeah, so I do prefer that they have a scale at home. That's something that I recommend, because getting used to what 2 ounces looks like can vary over time. You might think it's 2 ounces, but then it's really 1.5, and that can make a big difference early on. So when it comes to that, weighing is preferred, but of course there's other ways to do it. So for example, the palm of your hand, a woman's hand, that's 3 ounces, and we focused on that. So a lot of times in their visits, I would say, well, on the palm of your hand, how much chicken breast can you eat at one time? And they would say half of it. So, okay, that's probably 1.5, 2 ounces at that point. And we always work towards the goal of 3, but listening to your body and stopping when it's telling you to stop. And that will change over time.
Very cool. So then when it comes to the fruits and vegetables, were there limits right after surgery or later in surgery of how much they should be having?
Yeah. So to start off, you don't even add in fruits and vegetables in their whole form until about 6 weeks after surgery. And then at that point, it's probably just a couple of bites. The goal eventually is a minimum of 1/2 cup, about 3 to 6 months after surgery, depending on how they're adjusting to the surgery. And then long term, I don't like when people think like that's their limit. They can only have that 1/2 cup at that point. If your appetite's increasing, continue to increase your portion on the protein and the vegetables, up to a cup and a half for some people.
Okay. So the vertical sleeve gastrectomy doesn't change any of the intestines. For anybody listening, we'll probably have a surgeon on here that goes through it in much better detail than I would. I don't do the surgery. During my training, I helped with all the surgeries and really wanted to get to know it. But ultimately, you don't want me doing surgery. I'll probably sew your intestine to your elbow. So I'm kidding only. I'd probably be a little bit better than that. But the vertical sleeve gastrectomy basically turns your stomach into like a small banana as opposed to like a big, thick, like I would say, like almost looks like some sort of squash. But then it turns into they cut out a major portion of it and it looks like a small banana. But then the Roux-en-Y gastric bypass actually turns your stomach into a little pouch, and then your intestines are rearranged a little bit. And so how does the diet for that differ? Any differences with the gastric bypass versus the sleeve?
Yeah, the main difference there is the difference in digestion of fats and some carbohydrates. So in some cases, if you have too much carbohydrate or too much fat, there's something that's called dumping syndrome that can occur. I describe it as it feels like a low blood sugar, like you're sweating or, abdominal cramping, diarrhea, the not so fun stuff. So that can happen when you have foods that are too highly concentrated in fats or carbohydrates. So my example is usually like mashed potatoes and gravy. You have a lot of carbs there, maybe some butter and some fat, and that can trigger that response. So keeping those portions a lot smaller and then making better choices in those areas is important.
Got it. And then how long does that last? Does that last forever, or is that more in the first perioperative phase?
It seems to last most long term. So in the first year or so, that's probably the learning experiences, and then later on they kind of learn, maybe I should avoid things like this, and it happens less frequently. But sometimes at that 5-year mark, they're having symptoms and they don't know what it is, and it is dumping syndrome. So kind of reviewing those practices again.
Got it. Okay, so when you were in the clinic, did you see people that were plateauing and then starting to regain their weight? And then how did you address those patients at that time anyway?
Yeah, so it is very common to see plateaus, especially around the 6 month, 1 year mark. It really depends on the person. And sometimes the 3-year mark. Again, it just depends on the person. So at that point, we do a review of their diet, what's changed since you've had your surgery. Of course, maybe portion sizes have changed, but are you having more cravings? Are, you just not enjoying the foods that you're eating and just consistently snacking throughout the day looking for that satisfaction? What has changed? And really identifying those things. So once we identify what it is, typically it's the consistency in their meals has changed. There might be skipping meals again or not eating enough for what they need at this point in their journey. So possibly bumping up their portion sizes, creating more satisfying meals. Again, focusing on protein and produce and getting those vegetables in, making sure that they're having carbs at this point, a third cup to a half cup, depending on how much they can tolerate. And if none of that works, and of course, physical activity as well. So make sure they're lifting, bumping up the physical activity, strength training. But if none of that's working, we had a medical weight loss program there, and we would refer them to the nurse practitioner at that point and possibly use some pharmacotherapy.
Very cool. So then you transition to the cloud with us at Sequence. And we're very grateful for that because it's good to have the expertise since we have a large population of post-bariatric surgery patients. So with using medicines, we oftentimes use kind of this plate method. We're doing research on what might be the best method. There might be multiple methods that actually work, and it depends on the person, which is probably the case. It's kind of the case with anything, individualization. But how do you now deal with post-bariatric patients while also kind of using this plate method while on medicines? How does anything change in particular, or how do you mix the two?
Yeah, so I'm actually working on creating a different visual for the plate method for our bariatric patients, but
Perfect.
It is very similar. The plate size changes, so you're going from a 9-inch plate maybe to a 7-inch plate. So then the proportions change a little bit. The protein portion is still going to be 3 to 6 ounces for most people, but on a bariatric plate, that is about half of your plate versus where the everyday patient, half of their plate is vegetables. So then for a bariatric patient, the quarter of the plate is vegetables and a quarter of the plate is carbohydrates. There's a little reduction there in the portion size to make room for that protein.
Got it. Do you find that people after bariatric surgery, you told them to do the multivitamins and minerals, when they come here now, they're usually like, we get some people that's like, it's been 6 months and they've plateaued, they want to keep going. But oftentimes they're a year or so out from bariatric surgery and then they come to us. Are you finding people are still using their multivitamin mineral formulas, or do you find like, hey, you stop that, you should really go back on that? What's your experience?
I would say about 75% of the members that I've met with are still on them, but that 25% is not, and that is the first thing that I ask. I'm like, are you taking your vitamins? No, and they're complaining maybe of low energy, fatigue. It's a good time to restart those vitamins. We call them vitamins for life for a reason, especially with the bypass. You're not absorbing the things that you were absorbing before, even if you are eating more food. So it is really important to continue taking those.
Are these patients following up with their surgeons, do you feel like, and getting their nutrients tested via labs, or have they just been lost to follow up to them and now they're with us?
I'd say it's 50-50 there. I do encourage them to follow up with their surgeon for their labs if they haven't. I say, have you gotten your labs taken in the last 1 to 2 years? And if they say no, I say, have you seen your surgeon lately? And that's when it either comes out that like the surgeon has left the practice or they're not following up. And that's when I encourage them to either talk with their primary care provider about getting their labs drawn, and I send them a list.
Got it. So yeah, we just started doing our own lab panels here for just obesity biomarkers, lipid panels and glycemia and that type of stuff. It's likely once we get everything ready, we'll probably have a post-bariatric surgery panel, and it's slightly different depending on the gastric sleeve versus the Roux-en-Y gastric bypass versus some of the others. So that's something we'll probably be able to do, and that will be actually very helpful for some that's like, I don't see my surgeon, I moved, and my PCP doesn't know which labs to get, because there's a whole list of labs, depending on which surgery you got that you're at risk for certain nutrient deficiencies. What about water intake? Do you have any specific recommendations there that's different from just somebody that didn't have surgery?
Yeah, so immediately after surgery, so if someone's in their first 6 months, we kind of lower the recommendation to 48 ounces, whereas for the average person, it's a minimum of 64 ounces. But the goal is always a minimum of 64 ounces, and just kind of working the way there. That can be difficult for a lot of our members who have had bariatric surgery because you can't drink within 20 to 30 minutes before your meal and 20 to 30 minutes after meal. So it's kind of a waiting game. When can I start drinking again? When am I going to get my fluids in? So working through that can be really important. Got
it. Anything else? Anything I'm missing here? I think you kind of detailed it pretty well. Do you feel like the post-bariatric surgery patients have a better grasp of nutrition than those who hadn't had it? Or do you think it's about the same?
I would say it's about the same. There's a lot of myths that are fed to bariatric surgery patients, and working through those is important. There's a lot of products that are targeting those patients as well, protein chips and protein bars and those sorts of things. So focusing on whole foods has been really important with those members, just because they're so used to that lifestyle where they're relying on protein drinks. So then, it's protein. So they're like, well, I can have these chips and get 20 grams of protein in it. It's way easier than eating meat, but the same quality isn't there and the same satiation isn't there. So focusing on those things has been really important.
I'm surprised. Protein chips are kind of gross, so I'm surprised. But I don't know. Maybe it's just easier to get in. I know protein shakes for me. If I'm like lag, I'm like I'll just drink a big shake. But like for this pure satiation, whole imagine eating 60 grams of protein from let's just say sirloin or salmon or something like that, versus just drinking it real quick with a big tasty kind of milkshakey tasty drink. It's kind of if you can imagine that, there's a big difference in satiety. Very good. Anything else that you think anybody wants to know about bariatric surgery nutrition and kind of mixing it in with using medicine?
Say it's just important to continue eating those 3 meals a day, even if you're not hungry. And I feel like members who have had bariatric surgery have even more reduced hunger because their stomach's already smaller. So it is really hard for them to get those portions in. Sometimes smaller, more frequent meals are better for those members as well.
Yeah. So for anybody listening, and you want to join our program, just know that if you've had surgery before, we have specialists when it comes to obviously the nutrition point. We have Cristina, and I believe we have a few others who have some experience with bariatric surgery. So we have you covered. If you are in the sequence program and you had surgery and you didn't know this existed, of course, make sure you reach out to your care coordinator and get scheduled with one of our RDs if you need it. I mean, some people may not need it. And of course, we do actually have a little community group that it's like a support group where those post-surgery can get together and talk about their experience using the medicines and going over the nutrition and everything like that. What about the psychological aspects of having clinicians support from people who really know this? What do you think? It's good to know that you have clinicians that actually know what's going on in this. I would say so if I'm a patient, to know we have their back and we have the experience.
Absolutely. And I believe we do have at least a couple clinicians who have experience in bariatric surgery on our team as well. And it can be super helpful just to know that. And we do have clinicians that have that experience. They understand what you're going through. Not all clinicians, out in the world, primary care doctors understand, what goes into having bariatric surgery and the nutrition implications with that as well. And then having support within a community of people who have had it. And our community support groups is awesome because not everyone knows your experience. People who are on GLP-1s and haven't had surgery might not be having the same experiences as you. And then having family and friends that support you and know what you're going through. There can be food pushers in the world, or they don't understand, what you have to do. They don't understand that you can't drink with your meal. Just those little things can make someone feel so isolated. So having that support is super important.
Yeah, going home for Thanksgiving dinner and your family's like, I mean, I hear all the stories from patients. It's like, you don't understand, Mom. Thanks a lot.
Right.
And yeah, it can be quite daunting. But if you have a group of other like peers that have gone through it, it's really helpful. Even if it's all digital peers, like online, a lot of people that you may not have met in real life can be much more supportive than even family members, which sounds counterintuitive, but it's true. So thank you so much for coming on. Anybody that is listening that had bariatric surgery and you're thinking about medicines, just know we have your back. I personally have helped create the training and awareness around bariatric surgery, and we have advisory boards and people helping us make sure we have the best team. And of course, we have Cristina, our amazing RD, really leading the charge on the nutrition when it comes to post-bariatric. And we're going to be even doing probably research in this little arena as well when it comes to post-bariatric surgery, using medicine and diets to optimize everything and help everybody get better. So thanks for coming on, Cristina. All right.